Hi, all. Thanks so much for joining. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta. And today we welcome Christin Deacon, who is the Assistant Director of the Division of Pension and Benefits for the state of New Jersey. Thanks for being here, Christin.
Thanks for having me.
Can you tell us, just as a brief overview, what is your role with the state of New Jersey?
I oversee our state health benefits plan and school employee health benefits plan for the Department of Treasury. We have about 820,000 lives across our lines of business. We represent all state employees and retirees, including institutes of higher education. And we also have membership in local governments and municipalities and some of our uniformed folks, as well as local education districts that choose to join our plan.
Awesome. So you're really invested in making sure that you're getting the best prices for the people who are part of your plans. And you've gone about it some creative ways. So I would love to hear about what your thinking is behind the pricing. And, when you're formulating these plans and making these deals, what are the most important things to you?
Sure. Yeah, I would just start by saying too, as a public sector and a bargain state, like we have very, very generous benefits. I think you classify them as Cadillac plus plus. And we're not about cost shifting to members as a way to sort of keep prices in check. So to your point about sort of being creative, the state over the last few years has had to come up with creative solutions to make sure that that spend trajectory is sustainable for the state and our taxpayers. A couple of examples include creative procurement methodology. It's something that's within our control. For example, our PBM, our pharmaceutical benefit manager contract that was rebid in 2018. We engaged in a unique process. I think we were the first public sector client to do this, but it was a reverse auction. And I know several states have followed suit since. But it really allowed, the market forces and competition to be put on display in having these vendors sort of go at it to win the state's business, and resulted in a contract that's credited with saving over 1.6 billion, that's with a B, over the 3-year life of that contract. And we'll certainly engage in a reverse auction again when it's time to bid.
Christin, the reverse auction, I think I get it, but could you describe a little bit of exactly how that works and what makes it a reverse?
Yeah. Usually it's something that's done on like a commodity basis, right? I know the feds do it and the Department of Defense had done it with commodities, but this is for a service contract. So basically we draft the technical scope and sort of pre-qualify bidders who would be able to service a client of our size, which is obviously some of the bigger players in the industry, but we pre-qualify them on a technical perspective. And then once they're qualified to sort of, we understand that they could handle this business, we have a contract in place, or sort of a contract outline in place, and they input in different rounds various guarantees and pricing guarantees. So whether that's a minimum rebate guarantee, a dispensing fee guarantee, et cetera, they'll input those items, and then ultimately our system kicks out what's a true bid price. And so round one, all of the bidders, they know what their price was, but it's unveiled. So they'll see how they stack up against bidder A, B, C, and D. And they're like, all right, I got to sharpen my pencil a little bit. And I sort of analogize it to a boxing match. The way that we've sort of seen this play out is that first round, they're seeing where they land against their competition. The second round, they're tinkering around the edges. And the third round, the gloves come off. They get really aggressive on pricing in order to win our business. And it's great because as the potential client, they're competing against each other for our business. And if you have any other public sector folks listening, public procurement can be a beast of, a time trying to get qualified bidders in and then do the evaluation. This comes down to the numbers. And we see when that happens, we get really positive outcome.
Is that something that employers or other groups that aren't as large as your state could do?
Oh, absolutely. Absolutely. I mean, the technology's out there. I know some have done it. basically a homegrown process of a reverse auction. We did use a vendor to conduct ours just because of the sort of complexity of our plans. We have over 20 plans across all of our populations. So, but yeah, I mean, it's something that can be scaled to a large or small employer. Absolutely.
Yeah, it's really fascinating. It feels like anybody could be doing it, right? A hospital could do it, a payer could do it, everybody's always
Right.
looking for vendors, and the standard process is RFP, and now we'll get, a bunch
Right.
of people submitting. So that's really fascinating what you've described. I'd love to ask Christin, you had also shared with us at the outset when we were talking about some innovative strategies you've been developing in the provider arena as well. Maybe you could share some thoughts on that.
Sure. I'll talk about first, I guess we're talking about procurement and creative strategies. Our TPA contract that has really resulted in substantial savings being booked by the state over the last couple of years, and also some direct relationships with provider groups that we're exploring right now. But first on the contracting piece, we have, as a state, sort of decided to move away from reviewing your third-party administrator services and evaluating based on a discount guarantee. I like to say, I'll take a transparent price over a 99% discount any day of the week. So moving away from that sort of elusive discount analysis and towards a unit cost guarantee when we're doing our review of the bids, and then also holding that bidder to that unit price cost guarantee year over year. So if you bid that this CPT code or set of CPT codes or DRG was this price, you're now going to tell me that price isn't going to go up on an aggregate basis year over year. And we've seen that that's resulted in substantial savings, and it really drives the TPA to drive a harder bargain with those provider systems. From a direct sort of relationship with providers perspective, the state is looking to partner with and roll out in the next plan year bundled pricing and centers of excellence approach across our population. I mean, we are very much of the opinion that we want our members going to high quality providers. My good friend Al Lewis, who I find highly entertaining, and I'm sure a lot of people on the listening know of him, taught me very early on. He said, the number one cause of spinal fusion surgery is a failed spinal fusion surgery. So it just sort of hammers home the importance of getting to the right provider in the first instance. Not only is it going to result in better health outcomes for your members, which we care about, but it's also good for the bottom line, right? We don't want failed surgeries. We want the best of the best performing specialty care on our members. Because ultimately it's better for everybody. So we're definitely looking to partner with some of these really high quality, innovative providers in our system. We have a lot of great systems in the state of New Jersey that have made great investments in their quality of care. And we want our members to make sure that they're incentivized to go to those providers.
Does your method create that same sense of positive I can't say that word right now, competitiveness between providers who are like, oh my gosh, I love what the state's doing with their people. I want to be part of that group. I want to be on their centers of excellence, on their provider list. Do you see like now there's sort of a buzz within the provider community to be part of your networks?
Yeah, absolutely. We actually just hosted a health benefits summit with our consultant, in partnership with our consultant, The Upside Effect. And one of the days of that summit was dedicated to listening to and collaborating with and learning from our provider community. And, seriously, like they're all over here saying, me first. We want to partner because we believe in our outcomes. We will take risks. We want to take risks because we believe. And, it's really about, rising the tide, right? Not sort of, moving to the lowest common denominator when it comes to quality, because they do want to compete. They do, their businesses too. They want market share, but if they get market share by higher quality outcomes, we all win, right? So that's really I think the goal And we're excited about the halo effect that comes from a population our size. We represent across the SHBP, so the population we represent, and Medicaid, the state of New Jersey pays for over 50% of the births in our state. If we can get our maternal centers of excellence and better health outcomes from our moms and babies, like that benefits every citizen in the state of New Jersey from an outcomes perspective.
Tremendous. I think you're bringing such a fresh perspective. I guess it feels like a breath of fresh air, because as we talk about this, there's a lot of heaviness in the air. Unfortunately, it tends to feel like, well, it's 2021 and we haven't made enough progress and we still have some of the same issues and they've been going on for decades. Is the industry really ready for change? Are the incumbents too entrenched? And yet you're bringing a completely different perspective. I know that these are the pockets of excellence that are emerging, but maybe if we take it up to that level a little bit, how do you think about what you're doing in the big picture of what the overall industry has been trying to accomplish over a long period of time? Where are we really at on this journey? And how can, organizations like yours, push it even further?
You raise a good point about sort of the entrenched interests and the industry being ready for change. I think we're talking a lot about change. I think we're talking a lot about ideas, and there are some really innovative employers and groups out there doing interesting work. But as sort of an industry, like what is the catalyst for more forward momentum in that change? I think it's coming. It feels like it's almost here. I don't think it's happened yet. But at 17% of the GDP, whether we're recognizing that the dollars that we're spending on healthcare, right? And then, we just got our, mortality rates have gone down, and we have to start thinking about what we're paying for, right? We want to have the best healthcare system in the world. We want to have the most research and development, the best drugs, the most, the most forward-thinking therapies. But we also need to understand like the value that we're getting from it. And when I say value, I don't mean the highest cost thing. I mean value, like what value are we getting from the real dollars that we're spending, and lost opportunity costs, whether it's addressing climate change or any of the other national priorities we have. Like 17% of the GDP is mammoth. And I do think that as self-funded employers, large corporations, states, recognize that they can, like it is their responsibility to turn that needle and pay attention as fiduciaries. I think that's ultimately going to be where that catalyst, that moment happens, where we're pushing, and I think we know what that roadmap looks like. It's how quickly we can get there.
Very interesting. Very interesting. So Christin, maybe Stephanie, if you don't mind, I'll ask a follow-up, because it feels like, we've been on this precipice before, and we've had the sense that it's going to happen. And it was the managed care competition, and then it was pay for performance and a variety of different things. But Christin, it does sound like you think something may be different, maybe boiling, although of course you're saying we haven't reached the catalytic point yet. So what feels different to you right now?
Yeah, what feels different is the fact that, all those transitionary moments, or sort of the precipices that you were just describing, occurred at a time when health benefits and health benefits oversight and management was really primarily, or almost entirely, in the purview of like a CHRO, Chief Human Resource Officer, or, somebody in that sort of role. And what I see is different now is it's not only the CHRO, but it's the CFO, right? Like as companies like Starbucks pay more for health benefits than they do for coffee beans, right? Somebody's paying attention and saying, this, if you're a CFO, or, you're in the finance department of your company responsible for P&L, like, you've got to pay attention to this. And as it continues, we can't just continue on our trajectory. And so what feels different to me is that, groups like the Pacific Group on Business Group on Health, and some of these other, like, employers are paying attention, and the CFO is paying attention. And I don't just mean the CFO, I mean, those that sort of serve in that role, that feels different to me. And I think if we start to treat our healthcare spend like we would any other line item in our budget, right? Look at, okay, how much did I pay for that claim and why? Is that reasonable? What oversight am I having over that claim? What are these vendor fees? Like, these are all questions that would be standard in any other line item. So I do think that that's absolutely going to be part of the catalyst that gets us there quicker.
It definitely sounds like there's a collaborative approach, which again is a theme that we hear in so many of these interviews that we do. The change makers are always collaborating, not tearing down one another.
Right.
And so along with that, you're getting on, everybody's on board, whether, from the C-suite inside of the company, everybody's saying, okay, we realize this is important, to the providers in your community saying, oh my gosh, we want to be on that list. But then the patients, all of the people on your plans, they definitely have some responsibility too, because they have to learn how these work. So how are you reaching to them and letting them know, first of all, the value in the work that you're doing, but also their responsibility in this?
Yeah. So it's such a great question. And it's so challenging because it's an industry, and it's an industry I didn't grow up in, but healthcare, it's an industry that we don't have a lot of trust from the consumer, right? When a healthcare consumer thinks about their insurance company, right? I don't know that they think, wow, this company really has my best interest in mind from a population health perspective, right? We have to regain that trust. And so whether it's a communications campaign, a reform that's being implemented, or an initiative, you always have to come at it from the lens of, how do I build trust? And not only how do I build trust, but being very careful not to lose trust, because again, we haven't done a great job. In my role with the sort of diverse population that we have, whether it be in a demographic, from an age perspective, or our members are across the country because we have retirees all over the place. And even the populations we serve in, whether it's a uniformed union group or the teachers, it has to be multi-channel. And we rely heavily on our stakeholder groups and our union groups and labor groups, because a lot of that's a trusted source for people. So you have to find the trusted source for that individual, equip that trusted source with good information. And I do think that we're at a place where we need to start trusting the capacity of our healthcare consumers to be smart, right? And informing them, and not speaking at them, but speaking to them. I think is really important, again, just to rebuild that trust. But it's a heavy task. It's taken years to get us where we are. It'll take a while to get us back on track. And it's a new track. It's an uncharted territory, if you will. So read Marshall Allen's book, buy it for all your employees. It's so funny that as an employer, would you ever give an employee a $20,000 piece of equipment and say, good luck with that, I'm just going to let you do your thing, right? Yet we give them these very generous health benefits with nothing to equip them. Half of the American public doesn't know the difference between co-insurance or co-payment, right? Yet we're giving this tremendously valuable and potentially crippling, right? When we're talking about, healthcare debt, with really no good information. That $20 you'll spend on a book will pay off in dividends, I'm sure, on your bottom line as a company down the road.
I love what you had to say about trust. In my world of consulting and change management, it really all comes back to trust as well. And you said it right, that, it takes a long time to earn that trust. So, we have to be patient. And then something, you said earlier, before we even started the interview, you said transparency is really just the beginning. And as I think of it, transparency is kind of a precursor requirement for trust. So we're just at the really beginning stages, maybe, of the change I think you're talking about. Can you talk a little bit about how you see that transparency and trust connection, and where do we need to go over the next, let's call it a decade plus, not to put too much pressure on ourselves to continue building on this journey.
Yeah, I mean, you use the word precursor. That's, I sort of say it's a condition, like it's a precondition to, right? And, I find tremendous value in transparency. Transparency for transparency's sake is not going to get us there. But it's necessary. And I will tie it back to trust, right? Because we've told consumers in the healthcare marketplace is it's too complicated. Let us figure out the fine, like it, you don't need to know the price because it's too complicated. It's too much. And we've told employers that too, who are actually funding the bill, right? I think that day is over. Like again, going back to I don't know, I want to know the discount. I want to know the price. It's not that complicated. It's perhaps complicated by your own making because it might serve your purpose. But yeah, I think transparency is like fundamental to then build off that foundation, our path forward. And like you said, it's we're not going to fix healthcare, right? Healthcare, it's almost, it's an evolution. If you approach it from the sort of mindset that we're going to fix it and forget it, that's what got us into this problem, right? Like that's why we find ourselves where we are. It's a constant evolution. We have to do better. We have to manage that path forward. There are no quick fixes. That's the simple truth. It's going to be a lot of hard work. It's going to take a lot of leadership. It's going to take a lot of testicular fortitude by our politicians to take on entrenched interests. But we can get there. But it is going to be hard work, and there is no easy fix.
When somebody is dealing with this and just maybe they're in a new role and they say, oh my God, these benefits are out of control. We have lots of claims. We're paying too much. What is their first step? What is the number one bullet point when they're looking to make a change in their plan and better serve everyone involved?
You have to not be scared of change, right? You have to think about, again, forward progress, not as disruption and abrasion and all of the negative terminology that for some reason we've used in the industry to talk about smart things that we need to do, and whether that's mandatory generic, closed formulary. There are words that we can use to describe forward progress and a narration that will help our members understand what we're doing. And I use the example of like the drug pipeline. When we move our members to a formulary with a vigilant drug list that has a mandatory generic provision, it's not because we're trying to take something from you, and it's not because we want to pocket that money. It's because there's a drug pipeline out there with a $2 million therapy that is imminent, and it's life-changing and it's life-saving. If you want your members to have access to those types of life-changing and life-saving drugs, we have to do the smart things today and think of it as, again, forward progress, not moving backwards or taking something away.
Thank you so much. I appreciated this conversation, and we really are so thankful that you were here to chat with us today.
Thanks for having me. As you can tell, I'll talk anytime.
This is fabulous, Christin. Thank you so much.
And thank you all for watching. Bye-bye.